Hair loss or alopecia is a common affliction that affects both men and women, and many patients try to self-medicate themselves before seeing their doctors. This is not always a wise decision because oversupplementation of some vitamins and minerals can actually cause hair loss. In this video, we discuss the supplementation of minerals and vitamins in hair loss, and we urge you to discuss any treatments with your doctor. Stick around to learn more. Hair follicles are among the most metabolically active tissues in our bodies. Hair grows through a growth phase and a resting phase that include an anagen or active growth phase, a catagen or a transitional phase, and a telogen or a resting phase. Because the hair follicle matrix cell is one of the most rapidly dividing cells in the body, hair growth requires an adequate supply of vitamins and minerals, and any nutritional deficiencies can affect the structure and the growth of hair. Iron deficiency is the world's most common nutritional deficiency, and it's a well-known cause of hair loss. Some studies have found low iron stores in patients with chronic hair loss conditions such as telogen effluvium, female pattern hair loss, androgenic alopecia, and alopecia areata. Other studies have found no such link. There are no definitive answers, so patients with hair loss and iron deficiency must be approached on a case-by-case basis. Zinc is an essential mineral that is required by hundreds of enzymes that are important in protein synthesis as well as cell division. Patients with zinc deficiency can have diarrhea as well as weakened immune systems and delayed wound healing, while their hair manifestations include hair loss and brittle hair. One study showed the reversal of hair loss in patients with zinc deficiency with zinc supplementation, but we still do not know whether zinc supplementation in the absence of zinc deficiency is beneficial in hair loss. Zinc toxicity can occur with oversupplementation of zinc. Pellagra, a disease that is caused by the deficiency of niacin or vitamin B3, is a well-known cause of the triad of dermatitis, diarrhea, and dementia, as well as hair loss. So far, no studies on niacin levels in patients with hair loss have been reported. Deficiency of the polyunsaturated essential fatty acids can lead to hair changes such as loss of scalp hair, loss of eyebrows, and lightening of the hair. However, we have little information on the effects of its supplementation. In one patient who had a deficiency of essential fatty acids, a topical application of safflower oil high in linoleic acid resulted in hair growth. Selenium is an essential trace element that is an antioxidant and that supports hair follicle development. Rats deficient in selenium showed sparse hair growth, but very little research has been done on selenium deficiency and hair loss in humans. One case report in a child reported sparse hair growth that resolved with supplementation. Selenium toxicity can occur with oversupplementation and can cause blistering skin lesions, gastrointestinal symptoms, and memory disturbances, as well as generalized hair loss. Animal studies suggest that vitamin D is important in hair follicle function. One study in 8 women with telogen effluvium and female pattern hair loss showed that the levels of vitamin D2 in the blood were significantly lower than in healthy people. However, we still need additional data on the supplementation of vitamin D in hair loss. In mouse studies, vitamin A was shown to activate hair follicle stem cells. But in humans, a high level of vitamin A, hypervitaminosis A, has been strongly linked to hair loss, as well as other effects such as vision, skin, and bone changes. The E family of vitamins are powerful antioxidants. Too much vitamin E, however, can be harmful and can increase the risk of bleeding, decrease the level of thyroid hormones in the blood, as well as suppress hair growth. Vitamin C is important for the absorption of iron, so patients with hair loss and iron deficiency should take vitamin C. Symptoms of biotin or vitamin B7 deficiency include a skin rash, inflammation of the eye, and hair loss. One study done on an infant that was fed on a formula that lacked sufficient biotin content reported inflammation of the skin around the mouth as well as patchy hair loss, both of which resolved once the patient was fed a diet rich in biotin. No clinical trials have shown efficacy of treating hair loss with biotin without there being a deficiency. Protein deficiency, for example, in Kwashiorkor or Marasmas, can cause thinning of hair and hair loss. So in conclusion, scientific evidence regarding supplementation of vitamins and minerals in hair loss is still in its infancy. But in general, if there is a deficiency, we should correct it. If you have risk factors for vitamin or mineral deficiency and you suffer from hair loss or alopecia, your doctor may want to test for deficiencies. Remember, oversupplementation of some nutrients can be harmful, and oversupplementation of vitamin A, vitamin E, or selenium can actually cause hair loss. If you liked this video and you found it helpful in any way, share the video with your friends and family, leave your comments in the box below, and subscribe to the channel to support the channel. Until the next video, thank you for watching and stay healthy and stay safe.